Okay, we're going to be continuing where we left off. The last slide that we covered was talking about the gluteus maximus in terms of its origin was the ala of the ilium. So now we're looking at the gluteus medius, and it wants to know what its origin is for the gluteus medius. And the, sorry, let me go back here. Yep, okay, so this was the gluteus maximus origin. And now we're looking at the origin or the proximal attachment for this muscle. So let's look at the choices here. Now, could it be lesser sciatic notch? No. Could it be the ischial tuberosity? No. Could it be the greater sciatic notch? No. What about the greater trochanter or lesser trochanter? Well, if we were talking about the insertion of the gluteus medius and minimus, then we'd say the greater trochanter. But since we're talking about the origin, we're going to say the ala of the ilium. Now here we're looking at the posterior hamstring. The hamstrings are the bicep femoris, long head and short head, and then semitendinosus and membranosus, which are more medial. Here's the sciatic nerve, so we know we're looking at this from the posterior. Gluteus maximus and medius is cut. So this is the short head of the bicep femoris. It's the only part of the hamstring that does not originate off the ischial tuberosity. All the other hamstrings originate off the ischial tuberosity. And then the insertion would be on the head of the fibula. So the origin here is on the linea aspera, which is on the posterior femur. So what is the origin? So here is the short head of the bicep femoris. It originates on the linea aspera and inserts on the head of the fibula. Now the other two hamstrings are the semitendinosus and membranosus. When you look at the choices, semitendinosus and membranosus has the M for more medial, and semitendinosus is more lateral to it. So it originates on the ischial tube and inserts all the way down here on the tibial condyle on the inside. So it's the medial condyle of the tibia would be the insertion of the semitendinosus. Now we're looking at the quadricep muscles, and we need to name them. So if we look at the one that originates on the AIIS, that's the rectus femoris. Remember, this muscle here is the sartorius, longest muscle in the body. This is the TFL, tensor fascial latae, which inserts on the iliotibial tract. So this is the rectus femoris. Lateral to it is the vastus lateralis. Medial to it is the vastus medialis. And in between the medialis and lateralis is the vastus intermedius. All of these quadriceps attach to the patella, cross over the patella, and insert on the tibial tuberosity. They all extend the knee or extend the leg. The only one that's involved in hip movement would be the rectus femoris because it crosses the hip by originating on the AIIS, the anterior inferior iliac spine, whereas the TFL and sartorius originate on the anterior superior iliac spine. So what is this structure that's highlighted? Quadricep femoris. What is the action? Extension of the knee or extension of the leg of the quads. What is the insertion? Well, it inserts on the patella, but then crosses over and inserts on the tibia at the tibial tuberosity. Of these, the only and best choice would be the patella. Now we have to know their actions. What are the hip extensors and the hip flexors? Another way of saying hip would be thigh extension and thigh flexion. So gluteus maximus is your primary hip extensor. And then your hamstrings can also extend the thigh. Semitendinosus, semimembranosus, they can both extend the thigh. But in terms of the biceps, remember biceps has a short head and long head. Only the long head originates on the ischial tuberosity. So the long head can extend the thigh, but not the short head. In terms of flexing the thigh, we have to now think what group of muscles are in front of the thigh. That has to be the iliopsoas, So it's the iliacus and psoas major. Then the TFL, the tensor fasciae latae and sartorius, that both originate on the anterior superior iliac spine. And then the rectus femoris that originates on the AIIS. Those are all flexors of the thigh. Now we're looking at the adductors, or the medial compartment. So this one here would be the adductor longus. The one above it is the adductor brevis. The adductor longus and brevis really originate near that pubic tubercle, near the pubic symphysis. And that's important because there's another muscle called the pectineus that looks like the brevis, but it originates higher up on that pubic bone. So here's the adductor longus, and again, there's the adductor brevis, adductor longus, and now this one is the pectineus, right? If you look at the difference, this one originates high up on the pubic bone, whereas these are more midline, right? That adductor brevis for sure. Okay, now this one is the gracilis, and it wants to know where is the origin. So the origin is going to be anywhere here on the pubic bone. So the best answer is pubis. None of the others make sense. In terms of insertion, the insertion would be on the tibial shaft.